Hi, this is Scott McGann doing our weekly COVID-19 update for the town of Falmouth. Today's January 8th, 2021. This is our weekly update. The Falmouth Health Department can be reached at 508-495-7485. Our general email box is health@falmouthma.gov, and our website is falmouthmass.us. There's a COVID page link right on the front page. So as of today, there's 761 cases of COVID-19 since the beginning of the outbreak on March 19th of last year. This past week, there's been 30 probable cases and 46 confirmed cases during the 7-day period. About 85% of total cases are no longer in isolation. It's somewhere around 90 or so. Falmouth has approximately 12.7% of all cases in Barnstable County, with 14 being expected, which is about the same as what we were last week. The VNA and the Community Tracing Collaborative at the state, with the support, of course, of the Health Department, continue to do the normal contact tracing, isolations, and quarantine as needed. So that's where we're at for this particular week. If you look at our caseload, this is our weekly. Each dot represents a week since the pandemic began, and you can see that we are slightly better. We are better than what we were the previous 4 weeks. Some of those previous 4 weeks, especially earlier in December, were long-term care. The week that we had the highest of 83 was not as much long-term care, more community, probably fallout from Thanksgiving and different things and holidays and people sort of getting together. And so now we're in that sort of around 50 or so cases, and it shows that in the last couple of weeks at least we've sort of come down to around 50. Hopefully we can knock it to 40 next week and so on and so forth, because it does take a little bit of time for it to sort of fall down. We'd like to get it back obviously to at least under 20 cases per week would be nice, and like we were in the summer, less than 10 would be awesome. So that's kind of where we are with our weekly sort of case trend. This one here just shows all the cases, and hopefully you can see the sharp increase, the steeper the angle on this chart, the more rapidly the cases are increasing. And you can see that hopefully we can flatten that out. And that curve is definitely still in the wrong direction, but it's showing, with the last couple of weeks that maybe it might be flattening a little bit. Let's hope so. And so the only way that to happen is to do all the social distancing and mask wearing and lack of gatherings, and we'll talk about that in a minute, but that's the key right now. Color chart, again, yellow, red, green. Ours would be 43 or more cases. If we're less than 5% positivity, that's the total number of tests and the total number of positives. If it's less than 5%, we'd stay yellow. If we have greater than 43 and we're 5% or higher, we would go to red. So for our 6th straight week, we are yellow. In the 14-day count, now again, this is the 2 previous weeks prior to last full week, so it's from 12/20 to 1/2. And we were at 111 as a case count. 741 was at the time as our count. We're at 761 now, so this was taken on, I believe they take it on Saturday. It shows that we're doing about the same. We're sort of in that same area for the last 3-4 weeks. In that 100, about roughly around that 60 cases per week, 50, 60, somewhere in there. For our positivity is a little bit higher than when those counts were before, because over the holidays you had less testing. You lost a test day. So instead of being 4,200 tests in 2 weeks, we're around 300 to 3,500. And so that brought the positivity up, because the number of tests determined your positivity based on the number of cases. And, so maybe if we keep the number of tests, if the number of cases stayed stagnant somewhere around 120, but our testing went back up into the 4,000 ranges, then our positivity would dip below 4. But we are maintaining the yellow. A lot of towns on the Cape are in red this week. It's not been a good week in general for a lot of towns. But we seem to be somewhat holding our own and hopefully get better. If you look at Barnstable County in general, their positivity was 37.5 per 100,000 over 14 days, so about 12 per 100,000 higher. The positivity rate for the county is up at 6.29. So you can see that the county has been struggling this week, and we've sort of been holding our own, though not great. The state is much, much higher at 61.1 per 100,000, so we're almost, we're definitely more than half of that better. And their positivity for that same 14-day time frame is 7.71%, and we're considerably doing better than that. We've generally done better than the state, and some weeks we've done better than the county. A few times we've not done as well as the county. In general, we've done a little bit better than the county in terms of those metrics. But so that's where we're at for our for our counts, at least for that time frame. Barnstable County, you can see that this has been a slight, even though, not as bad as it was, let's say, right around the new year with the 3-day average of being like 220 cases, on certain days like that. Now you see more 90s and 60s. Hopefully that starts to come back down. It'd be nice to keep the low counts as the vaccine starts to roll out and just seamlessly go from low counts to a vaccine. That would be nice. And that's hopefully what we do is we sort of flatten this curve of cases that we've had since the fall. Well, actually, since around December. Now, the state dashboard. So, sorry, each week you saw what the charts, if you've seen this presentation before, this looks a little bit different. This past week, the state changed its dashboard. And so you would, on the left-hand column, you can click on each one of these individuals, and then they would give you a breakdown inside. So it's a little bit different for me, the way I can present it to you. So I'm going to do a little less slides. We'll talk a little bit more about the vaccine. I'd like to give you good news. So on this particular date, this would be the January 6th data, 6,400 cases, 100,000 tests, 2,400 hospitalizations, 442 patients in the ICU, and 281 patients intubated, with 99 confirmed deaths on this particular day. So you can get the dashboard, just looks different. The turnaround time's been around 2 days. It's been as high as 3. They've got it back down around 2 days. And the 7-day average for this particular time frame, again, it's a little slightly different time frame that was taken for the full 2 weeks of the previous slide, was 8.25%. So this one is clicking on the hospitalization tab that would be on the left, or this was, the trend tab, obviously, the overview trend, tab. And it shows that, the positivity's up, but maybe slightly less than it was a week or two ago. You see a little bit of dipping. Hopefully that continues. And so you can get all the same data if you're one of those that like to look at all the data. I mean, it's not great. It's kind of what it's been over the last few weeks. And you can refer to the dashboard every day to get these charts and graphs. So I'm going to move on from there to what we're doing here at the county, what's going on at our level. This is hospitalizations. Down at the bottom, you see 1721. Cape Cod Hospital had 23 hospital beds with 9 in the ICU. Falmouth Hospital had 17 at the hospital with 4 in the ICU, for a grand total of 40 in the hospital between the two, and 13 in the ICU, which is similar to what we saw in April. So definitely the surge in cases has resulted in an increase in hospitalizations. And so that's very, you can see that's sort of similar to what was on 1.5, 42 and 10, 40 and 13. But slightly better than what we saw on 1229, but not as good as we saw on 1222. So maybe hopefully this is, like, the cases maybe sort of flattened out a little bit. It's still high, but maybe leveled off. But you need a little bit more weeks of data to know exactly what's going to happen. I wish I could predict what was going to happen each particular week. So as far as COVID testing, again, the hospital's still doing the testing by appointment through the call center at 508-862-5595. You still have the walk-in clinics. I know now the reason why I put probables in the slides that I had before is I believe that the Convenient MD does that. Some of the pediatrician's office, I think, also have the rapid tests. So the rapid test is the one that determines a probable, whereas a confirmed would be a PCR test. I think you can do both now at Convenient MD. Community Health Center of Cape Cod and Mashpee also does it, and again, East Falmouth CVS. At the fairgrounds is a drive-through testing site that's operational. That number is 508-534-7103. Booked by that's if you don't have a primary care physician. Your primary care physician can also call and book an appointment there as well. More details, just go on barnstablecounty.org. And under testing, it gives you all the details of what you need if you want to go through the drive-through site at the fairgrounds that's sponsored by the county. So that's where you get your testing. And next we'll talk about what phase we're in. The governor extended this phase now. Okay, so I think till the end of the month, somewhere around in there. But you have your gatherings down, the capacities are down to 25% in most places. Gatherings outdoors would be 25, indoors is 10. So he's ramped down the gatherings, knowing that a lot of these gatherings and close contact situations are where the disease spreads. And so the governor has extended these restrictions. Again, social distancing, face covering, it's time to start implementing things you did to keep yourself safe in the spring now. We're definitely at as many or more cases than what we've seen ever before. And so it's time to, buckle down and start doing the things that you did to keep yourself safe at the beginning. Masks are required both indoors and outdoors, in public areas. Hand washing and hand sanitizing is important, reducing, eliminating travel, quarantining when you need to, avoiding gatherings, parties, definitely, and also staying home when ill. If you're younger, it might be as simple as, the sniffles or slight cold. It might be COVID, and then, you go to work and you happen to work at a long-term care and look, no one of that, we don't want to know what happens with that. It's really bad. So, losing your sense of taste and smell and thinking it's the food that you just bought, where it might be something a little bit more than that. So it's just, being aware of your symptoms and getting yourself out of contact with others if you have these symptoms and get a test. And also, if you're a business, you need to be following the state guidance. We don't get as many complaints as we had in the past. We do follow up on all complaints. You would call or email us at the information above that I gave you before, and we do follow up on complaints. Okay, let's talk about good news. The COVID vaccine. Okay, the website is, you can just Google it, or it's on mass.gov. It's when can I get the COVID-19 vaccine? It was updated last week. Well, actually, it was updated, I think, Monday, this slide was. Phase 1, Phase 2, and Phase 3. You can get this on their site as well. It gives you more detail about what each bullet point means if you go to this website. So the clinical and non-clinical healthcare. So Cape Cod Healthcare is already done, already into their second shots for some. Long-term care is in progress, and that's being done by, I've heard from CVS and so forth, that's being done privately, not through the health department. Health departments were asked to do first responders, which we've teamed up with the town of Sandwich, and Sandwich is doing our first responders starting on Monday, I believe, someday next week, I think Monday. Congregate care settings and shelters, that's being worked through. So all that's sort of in progress and on its way. And then, as the state gives us a lot of information, they have not given us a huge amount of detail about how things go after this. They're sort of giving it to us in small amounts to go to work on things as this list, as we take care of one in the list and we go on to the other, it's time, we work on different things. So as far as the health department, what we've been working on is securing a site. Also securing, getting vaccine approved to be brought over to Barnstable County to be stored there. Barnstable County will partner with us to provide the nurses through the MRC and their nurses and our clinic. And, we're at a point where we will start doing a clinic at some point in the future. How does it work? All the details that'll come out as they're all sort of cemented in. I'm looking at doing a drive-through, which changes the way that we normally would have an emergency dispensing site. So there's a lot of little things and a lot of details that are being worked out right now. There's also, on that website where I can get the vaccine, we'll start to show sites. There's going to be mass inoculation sites that are run by the state. Those are being worked out as well. So towns will do theirs. There'll be different opportunities. And so as information comes, we'll provide it. And we are getting a lot of phone calls, and we'll talk about that in a second, and different things, people want to know when they can get theirs. One of the changes that they did make in Phase 2 is they put individuals 75 and older up on the list. So you see the list of individuals with 2+ comorbidities and or over 75. So there'll be, that'll come when Phase 2 starts, and then we'll have things like, early education, sanitation, public works, food workers, agriculture. Then it goes to all adults over 65 and then individuals with one comorbidity. So we go through the bullet points as we get to it, and then Phase 3 will be the general public. And so all the details are still being worked out. It's obviously a monumental thing that no one is inherently geared to do. No matter how you look at it, getting 20 or 30,000 people through twice, because the Moderna vaccine and the Pfizer's, which we have approved, are both 21 or 28 days apart, depending on which one you get, is not necessarily an easy task to do. So it's being all worked through. There could be regionalizations. There might be town-wide. There's going to be some state ones, and there'll be the opportunities. So, like I said before, as of the state has asked the local boards of health to take care of the first responders. And our first responders are all set starting next week. They've signed up a couple weeks ago, and that's going to go through Sandwich, and thanks Sandwich for wanting to take that on. State hasn't released details to a point where I can tell you concretely how it's all going to work. Please don't call to schedule at this time. the health department has only so many people. If we're spending, half the time, instead of doing contact tracing, talking to people about, where we are with the vaccine, it's a little counterproductive. So if you don't mind, all this will be released when the time comes, when we have things set, when we know exactly what everybody's role is going to be, when the state releases more information, we'll make sure that everybody knows. One thing that's going to happen is the state's using a software system called PrepMod. So you would be registering on PrepMod. There'll be links and all that stuff for you when we get there. And you'd be filling out all that and registering on PrepMod. It makes it a lot easier if we're all using the same system. Instead of, calling the Falmouth Health Department to get it scheduled in Falmouth, you would schedule it through the state's PrepMod. And then that list, that would determine, that tells you, get you an appointment and things of that nature. Because we just can't have it, everybody show up on Tuesday, we'll have a vaccine for you, we're going to throw 20,000 cars through a line. It's not going to be able to work that way. So you'll start hearing that word PrepMod if you haven't heard it, and this is the first time. PrepMod's going to be the software system that the states are using. Barnstable County is already using it for their first responders because Sandwich is doing the Upper Cape, and then the Lower Cape is being done by Barnstable County through PrepMod. And it's a scheduling software. It's going to ask you all your information and put you in their system. If you're a medical personnel and you want to volunteer, I've had a lot of people call, and that's great because we're going to need, quite a few volunteers for a standing clinic. Not everybody can just keep inoculating all the time. That takes, the vaccine isn't, it comes in 10 vial dose, and you have to draw the vial, and so it's just there's some time involved with every shot. It's not one of these, real quick in and out. It's going to take at least a couple minutes a car, 3 minutes a car. So we're going to need a lot of volunteers, especially medical personnel if you want to. The MRC is the Medical Reserve Corps. Diana Gammond is the director of it. It's through Barnstable County. Her phone number is 508-375-6641, or you can email her at diana.gammond@barnstablecounty.org. And if you are medical, because I had 2 of those calls today, and that's where I refer them. So that's going to be the bank of nurses. I think there's a couple hundred at least in there now, and the more the merrier. And that will help. And also, there'll be ways, and I'll put my information if you're not a medical personnel, how you might want to through certain avenues, because it's just going to be, the more people we can have, and the longer we can do the clinics, the better. And so, as things unfold, then that will get you that information, that detail. So as a recap. The state metrics, way over 50% of towns are red, so the state remains high. It's been at this high plateau for a little while now. Falmouth cases, of course, have been highest since the beginning of the pandemic, but it has been stable over the last few weeks. Still, that could blow up at a moment's notice, right? So just, got to bear down on this. Community spread is definitely occurring. The vaccines are being administered through Cape Cod Healthcare, long-term care, first responders, congregate living, so we're into the vaccinations. The state's got a website about vaccinate. You can get a lot of stuff on mass.gov if you've got some time and you want to look at the details. It's in there. And then further information about how to get the vaccine will be released as everything becomes clearer and starts to unfold. The town does have an emergency dispensing program that did about 15 years ago. It's just, you have to tailor it to each specific event, and that's what we're working on now. So as more information gets solidified, then we'll definitely release it on this, my weekly update. So that's what we have for today, and I'll see everybody next Friday. Thanks.